Team Up came from a recognition that people who needed care delivered in their own homes weren't getting the best that we within the NHS and social care thought we could provide, because often they've got complex needs needing the input from more than one professional. Someone who's got lots of health and social needs might have coming into their home a social worker, carers, a physiotherapist, an occupational therapist, a GP, a district nurse.
As we have an ageing population with increasing health and social needs, the Team Up process was a real opportunity to bring multiple community agencies and multiple services together and try and get us all to work in slightly different ways.
Really what we want to change is so that everybody's focused on the individual they're trying to support, and they do that together.
The Team Up team within the ICB essentially managed to identify and ring fence a pot of funding and managed to come up with a service specification that was broad enough to allow innovation, and I guess distant enough to leave us to do the job with a degree of clinical autonomy on the ground. It was simply a remit to say, first of all, we will fund you to provide a more cohesive home visiting service. And secondly, we will mandate you to plug those home visiting services into other agencies that exist in the community, and we will ask you to develop relationships and links between these agencies to make it work better. So, and we were just left to get on with it, which was genuinely fabulous.
It's worked best where we've had services that are in the same building, the same room, so where home visiting and social care and district nursing are all in the same office. Actually, rather than writing a referral letter, a referral form, actually you just go and speak to your mate who's the other side of the room and go, oh, I've got this problem. Oh, you know, Mr. Jones, should we go together? Or and those relationships really are what make the difference for the patient and the people around them who their loved ones. They get a more responsive service. Actually, we get there quicker. The people who come, probably less people come, but they have a bit more time and they spend more time listening to really understand what the needs are, rather than going, well, this is my bit, this is what I do. We think we're preventing, probably on average over the years, about 1,000 people a year actually going to hospital, and perhaps 600-700 of those then being admitted.
We also measure quality of life scores. So for our complex care interventions, we measure pre and post intervention quality of life scores. The results are great. So it shows that the interventions and the support of the teams and the activity we're trying to provide makes a difference to people's perception of their own lives and people's perception of their quality of life, and that's incredibly rewarding. This is the start point of a process that has to continue, has to accelerate, and has to be supported.
So there are lots of indicators that it's absolutely the right thing to do. Have we got to the nub of really that relationship-based care rather than process-based care really is the thing? We're not quite there yet, but we're working really hard to try and demonstrate that.